So MGTA-145 is a novel drug. It's a CXCR2 agonist. And in healthy volunteers, it has shown the potential for rapid stem cell mobilization, especially when combined with Plerixafor. So we conducted this study, which is an investigator-initiated trial. It's the first study in cancer patients for stem cell mobilization. And what we did was we gave patients Plerixafor in the morning, followed 2 hours later by MGTA-145, and started stem cell collection in patients with myeloma within 30 minutes. So this was for transplant-eligible patients with myeloma. We accrued a total of 25 patients, and patients could then undergo stem cell transplant per usual standard of care guidelines with melphalan-based conditioning. What we found was this drug was very well tolerated. Pain was the most common side effect, which was seen in 50% of patients. And about a third of patients, this was acute onset pain within 5 minutes of giving the MGTA-145 infusion, and all but one patient's pain resolved without any medication. And, overall, it didn't last more than a few minutes. So well tolerated. And when we look at stem cell yield, so this is the first time, you can give a drug and collect cells on the same day. The other drugs you require to collect cells after a few days of injections. So the median stem cell yield in this 25 patient was 5 million CD34 positive cells per kg. And so the study design was such that patients could come back for a second day of collection if they collected less than 6 million. And so what we found was the first day of collection was obviously higher than the second day for patients who needed to come back for a second day. This is consistent with prior data. 88% of patients met the primary endpoint of collecting enough cells to proceed with a stem cell transplant, which is 2 million CD34 positive cells per kg. And really, when these patients underwent transplant, so far we have data on 18 patients. All 18 have engrafted. And in 13 patients, we have day 100 follow-up, and these patients all have durable engraftment. So again, this is a new method to collect stem cells, which can save patients time. They don't need to come back for injections multiple days. It can be easier logistically for centers and is a real advance in stem cell mobilization for patients with myeloma or other cancers as this drug is developed.